And now our third speaker of this late morning session now, can I ask Carole Longson to come and talk up from the ABPI perspective. Thank you.
Good morning, everyone, and thanks to the organisers for allowing me to come and give you a little bit of an insight into some industry perspectives on this. We've had a very, very powerful description of the benefits of collaboration. So thank you very much for that introduction. What I'm going to do, obviously, industry is a very broad church, and the pharmaceutical industry is just one within life sciences. I'm going to give you a little bit of a perspective in some of the work that we've done at ABPI to get insights from our members on the data landscape in the UK, opportunities and challenges. But actually, what we've learnt and talking to other parts of the sector is that the information that we've gleaned is very similar to what you would hear from really any life science sector. And it's pretty powerful, and I'm also an optimist, and it's definitely promising. So we know that this area and this sector matters. It matters to all of us. It also matters to government. And as an industry, across the piece, the engagement has been extremely positive about the perspective and the possibilities of the way that the transformation in the use of healthcare data can inform not just industry and its progress, but the progress of the health system overall, and definitely improved patients and a more efficient healthcare system. And what we've been doing inside ABPI over the last 18 months or so is trying to help shape that debate by being a bit of a conduit, really, a communication vehicle from life science companies into the various actors in the sector, including HDR UK and government. So help shaping that debate on how the UK is going to gear itself up to develop that world-class infrastructure. And to do that, of course, you need some insights from those that are going to use that healthcare data in industry about what that infrastructure needs to be. And so quite a lot of work has been done about getting underneath the bonnet of the infrastructure. And in doing so, try to inform the debate about how best that infrastructure is going to be able to engage with industry to best effect. And that best effect means benefits for both industry, but also for the healthcare system overall, and definitely for those that use it. And in doing that, try to form perhaps new ways or new thoughts on how industry collaborates with the ecosystem, with government, to enable this to happen, because we've again heard today the complexity of both the healthcare system overall, but also the complexity of the task at hand means that that type of collaboration will need to change. And as I'm going through the rest of the presentation, please bear in mind that what I'm going to talk about covers the entirety of what industry calls the value chain, which is research, discovery, development, and delivery of new technologies. So it's not just one of those domains, it's all of those domains that we need to have in mind when we're thinking about engagement with industry. So first of all, there is a huge amount of enthusiasm in the industry for this agenda, and definitely a coalescing of minds in the promise that the transformation of both availability, access, and the integrity of healthcare data will bring. They think across the piece that as an industry, if we can get this right, it's absolutely going to support innovation. And of course, what that support's going to do is hopefully drive the interest of doing that innovation in the UK itself. And that's a really important thing. The goals, as I've talked about, as others have talked about, of this transformation is first and foremost about outcomes, improving outcomes in the healthcare system for both patients and the operational effectiveness. Increasing efficiency in the NHS means being able to get better outcomes at lower cost. And part of that, hopefully, will be the introduction of new technologies that can both enable better outcomes and drive a more efficient healthcare system. Heard about how to achieve that just in this schematic. The healthcare data domain needs to cover all sorts of things. We've talked about trust in governments, we've talked a little bit about data management. Probably haven't gone on to the skills agenda, which is absolutely essential in order to be able to realise this potential. And the scale up in the understanding of both those who work inside the healthcare system and those who work in industry and academia about the potential of data science and those who can actually enable the use of that data for the benefits that we all want, I think is a really key part. And again, ABPI has done quite a lot of work on trying to articulate what that skills gap is, but more importantly, how best to fill it. So let's have a little foray into the trust and confidence theme from the perspective of industry, and particularly from the perspective of the pharmaceutical industry. We've been able to get some quite deep insights. Absolutely, without fail, all of the discussions that I've been involved in recognise that building trust in all domains across all stakeholder relationships is the absolute key to progressing this agenda. No doubt about it. One of the interesting things, I think, and again as an observer of coming recently new back into industry, is just how much many sectors of industry have been working with data and with academics and with the NHS over the years. And there's a huge amount of knowledge and experience already in the system about how to construct meaningful relationships between different actors in order to make sure that people feel comfortable about the use of data in a commercial environment. Maybe I should put it that way, rather than for commercial use. I think there is a distinction. The other important thing is that obviously many healthcare industries, particularly the pharmaceutical industry, has huge amount of experience in handling data. Do it in clinical trials day in, day out, do it for research and discovery day in, day out. And the acceptance of the transparency of the use of that data and also the reporting of that data, I think, is now very strong. And what's really important, probably doesn't get articulated, is overlooked, is that there is a code of conduct. There is a code of practice already, above and beyond the new principles about the commercial use of that data that have just been published. There's already a code of conduct about the way that industry, pharmaceutical industry, interacts with healthcare systems and patients. And that code of conduct is very much taken to heart and very much used and policed, for want of a better description, by the ABPI in all sorts of ways. And so there's already a platform for establishing that trusted relationships. And again, the feedback from industry, you won't be surprised that in order to make sure that that trust continues, the governance around this is really important. Public understanding, we've talked about, the protections in place. People have said safeguards. They've also used, other more powerful words in terms of sanctions for when it goes wrong. But that sort of concept, I think, is well embedded and well accepted, in that you must declare the use of the data purpose, and you also, if that doesn't happen appropriately, it's got to be transparent and there've got to be some sanctions. The most important thing, I think, that we've all discussed here today is about how to now take that to another level and develop those processes and procedures for the exchange of information and the exchange of values. And so again, as an industry, in talking to members of ABPI, the principles that have just been published are very widely supported. I think it's a good thing. Now, I've talked a little bit about where industry would use data, and it is absolutely everywhere in the development of new technologies. And the schematic at the top is, in a sense, the old visual representation of the way that the industry model of developing and using new technologies would happen. It doesn't happen like that anymore. It's absolutely a virtuous circle. It starts off with pure research, actually it wouldn't matter where you did that research. Would it be in a commercial environment, in a lab, in a pharmaceutical company or a tech company, or a lab in academia? It's about asking very basic questions about the understanding of disease and the epidemiology of populations. From there, you get to, is there actually an opportunity for intervention? That's either a target, a pharmaceutical target, or again, for medtech, the development of kit. And then that moves into, once you've got a target, can you actually develop a technology, right through to once you've done your clinical trials, taking up the vast majority of the research chain. How do you deliver that into the healthcare system in a way that is sustainable? And then how, within that use in the healthcare system, can you feed data back to either optimize the performance of that particular technology or develop new, better technologies? And so that chain, that cycle, is where we're talking about the use of data. Now, if we think about it in that way, then we have a huge amount of discussion about the types of exchanges and the types of relationships that need to be built in order to be able to supply that type of chain. And once we start talking about the commercial use of data, I think it doesn't really articulate the type of use that industry, not just industry, those in academia that are interested in developing new technologies, put it to use. And we've got to be really careful that in the words commercial use, we don't lose sight that actually the research is agnostic to the setting. That it doesn't, good research isn't just done in academia, isn't just done in industry, but all of that research requires good, robust data. So thinking about that chain, that cycle of the use of data, what are the ways in which that data needs to be delivered? And that's also a complex issue. And that complex issue needs to, again, be embedded into the infrastructure, the thinking about the infrastructure. The data sets that need to be used need to have three things. Optimally, all three in the same data set doesn't happen very often. It needs to have scale, so that's numbers. It needs to have depth, so that's the spread of information from any one particular person. And it also has to have duration that is collected over time. All of those things can be used individually, but actually the most benefit of the use of data to develop new technologies is that in the combination of all of those three domains coming together. Research projects, depending on the research question, of course, will use those domains in different ways. But we do have to think, again, about embedding both the infrastructure but also the conversation about the use of data, thinking about those domains and how they're going to be used and how the exchange of information is going to occur. And so if we think about this in context, and again, this is just a graphical representation of that, we hear a lot about the NHS having a huge amount of data. Well, it potentially does. So it has breadth, it has lots and lots of people and lots of events. The depth is it could be quite an interesting discussion. Sometimes the depth is there, but that doesn't really necessarily connect with the duration. It also might not connect with the different types of data sets you need to answer a specific research question. So again, we have to start thinking about and articulating the conversation with industry. What type of use is industry going to need? And is the NHS or is the healthcare system geared to be able to provide all of these domains in a way that would be of interest and of use to the healthcare industry? So if I'm thinking, for example, about the world that I used to inhabit, which is health technology assessment and trying to get a handle on the real life use of technologies once they get their marketing authorization, there's a real problem with being able to access that type of information of quality and depth and duration. And certainly a huge amount of frustration on the part of industry, but also on the parts of the health technology assessors in being able to use that data, even if they wanted to, because they can't access it in a quality that is amenable to national decision making. So here's an area, for example, where we probably don't spend as much time as we do talking about RCTs, but where the UK could have a specific niche that would be of great interest to industry. So, just one or two observations on some of the stories we've collected in our conversations with industry about how they're using the data, but probably more importantly, just trying to pick out some observations from that in terms of the challenges that there might be specific to the healthcare environment. Many of you in the audience will know about the Flatiron experience and the fact that Roche basically bought up Flatiron in order to be able to access their data set on cancer. The thing I'd like to get you to pay attention to is this last paragraph. The issue was not necessarily just about access to the data. It was about the ability to curate that data, to transform that data into a mode that was amenable to asking questions and being able to probe that. So that curation issue was the issue that industry had, and it couldn't go anywhere. It certainly couldn't go to the UK to do that. And basically, it was resolved by buying the company. Maybe the other one is just down at the bottom here about access to clinical trial cohorts. Really quite sad story about wanting to be able to do clinical trials in the UK and unfortunately not being able to because it took too long for the understanding of whether or not there was a patient footprint in the UK that was right for that particular clinical trial. They're the sorts of things that industry wants to do with the data. That's the challenge that we have. So what's really useful is that the step up to that challenge is already being done. And I absolutely must applaud and congratulate HDR UK for all the work that they've been doing, both convening the conversation about what industry needs, but also developing the system architecture for that engagement with industry. And the consensus is, if the aspiration that HDR UK have and the other actors in the Alliance have can actually get delivered in the UK, then what we will have is not only a world-class healthcare system data infrastructure, we will have a place that attracts global industry here. And that's absolutely a prize all of us want to deliver. Thank you.